Good afternoon. Welcome to this webinar on coronavirus pandemic and on the challenges for North America's Federalist democracies. Today, we welcome the participants as well as audiences connecting in Los Angeles, California, Mexico, the US, Canada, and throughout the world. My name is Ruben Hernandez Leon. I'm the director of the Center for Mexican Studies at UCLA, and I'm professor of sociology. And it is a great opportunity to collaborate with the program on Canadian Studies at UCLA. And on that point, I'm very happy to turn it to my colleague, Glenn McDonald, who's been a great partner organizing this event. Glenn.
Thank you, Ruben. I want to thank Ruben for the Center for Mexican Studies and International Institute and Latin American Studies, and Brian Pitts will be joining us later also from the International Institute and the Center for Latin American Studies. My name is Glenn McDonald, and I'm the chair of the Canadian Studies program at UCLA. And before I introduce our speakers, I'll just let you know that there is a chance for audience participation. There will be a question and answer period. On Zoom, you can use the Q&A function. The chat function will be disabled. You will not be able to speak. If you have questions, please use the Q&A function. Brian Pitts will be moderating those, and hopefully we'll get some of those into the broadcast. It is really a great pleasure for me today to introduce three really distinguished speakers. But before I do so, I do want to acknowledge that UCLA and UCLA Canadian Studies acknowledges that our campus is located on the lands of the Tongva peoples, traditional land caretakers of the Los Angeles Basin. And we are very grateful to have the opportunity to occupy those lands and to honor the ancestors, the modern Tongva, and the future generations at our institution. I also want to say that UCLA and UCLA Canadian Studies firmly supports the aspirations of all people and the Black Lives Matters movement. I would therefore now like to go on and introduce our speakers. Our first speaker today is Embajadora Marcela Solario, who is the Consul General for Mexico in Los Angeles. She is an attorney. She holds 2 master's degrees, one in diplomatic studies, and the other one is a master's degree in security and defense. She has also studied at the University of California at San Diego and was a visiting fellow in diplomat in residence at the American University in Washington, D.C. She has done research and written extensively on issues related to dual nationality, citizenship, security, and the integration of North America. Our second speaker is Zaib Sheikh, who is the Consul General of Canada for Los Angeles. He holds a Master's in Fine Arts from the University of Toronto, which happens to be my alma mater, so I'm very happy to announce that, and has an extensive career in media and entertainment industries, television, film, and indeed he founded the Whistler Theatre Project in British Columbia. He then went on to become the director for the Toronto Film Commission and the director of the entertainment industries for the city of Toronto. And I believe in 1 year, he more than doubled the film and television industry work that was done in the city. He's also served as a board member for the Institute of Canadian Citizenship, Canadian Centre for Diversity and Inclusion, and the Actors Fund of Canada. He's also been very involved with Amnesty International. And finally, then, we will have the views on this from Professor Jack Needleman, who is the Fred W. and Pamela K. Wasserman Professor and Chair of the Department of Health Policy and Management, the UCLA Fielding School of Public Health. Professor Needleman received his PhD in public policy from Harvard University. He is a health economist and political scientist. He works on organizational management and expertise in health policy and modeling and measuring of health provision. He has served as a consultant to many federal, state, governmental organizations. He's been elected a member of the U.S. National Academy for Medicine and is an honorary fellow of the American Academy of Nursing for his scholarship and his service to the nation and to the health sciences. So without further ado, I would like to then ask Embajadora Marcela Solario to begin our presentations. I'm afraid you're muted.
Okay.
There we go.
And thanks to UCLA for organizing this event. I am very happy to be able to share this panel of conversation with my dear colleague and partner in diplomacy, the Consul General Saif Sheikh. Thank you so much, Consul General. Professor Jack Needleman, definitely we have to learn a lot from you. And to my dear friend, Ruben Hernandez, and of course you, Glenn. Thank you so much. So I will start to share some thoughts and information, some data about what has Mexico done during this pandemic. First of all, I would like to ask you to keep in mind that the pandemic has hit in a different pace and intensity in each other's countries. And the same is reflected in my own country, in Mexico, because each state have different capabilities to face the pandemic. Up to date, I can say that we haven't surpassed the roughest patch of the pandemic, unfortunately. So lockdown measures at the national level, closure of businesses that are not considered essential, schools and crowded places are still in place. The Mexican health authorities have a daily interaction with the community to keep it informed. And according to official sources, the spread of the virus is managed. That doesn't mean that is over, but that is managed. It's very important to have that clear. I would like to underline in this regard the key role that the Ministry of Foreign Affairs is playing throughout this pandemic. Thanks to the coordination with our different representations around the world, we have been able to import COVID-19 screening tests and medical equipment, diagnostic and laboratory equipment, medicines, and of course, personal protective equipment for health workers and hygiene and disinfection supplies. The economic recovery plan will issue 3 million credits to be granted to businesses and workers to reactivate the economy. And technical guidelines for health safety have been designed for the work environment. Now, the federal government and the states, and especially border states, there is an important coordination between the federal government and these states. As I mentioned, the capabilities and the response from each state is different according to their capabilities, but all of them are following the general guidelines issued by the federal government. There is a very efficient dialogue among the consulates of Mexico along the border with local and state authorities on both countries. Remember that we're cross-border consuls, all of us that are posted at the border. So the coordination is very, very important. And as you know, there was an agreement among our countries to restrict the travels just to essential ones. So this has been proving a very effective coordination. We expect that this June 22nd, the borders among our countries will open for everybody. And it is very good to know that trade wasn't affected as it was foreseen at the beginning of the pandemic. There were a lot of concern along the border about that. What is Mexico doing regarding the research and academia, scientific advances? Well, Mexico, although it's not a country that is recognized by this endeavors, there has been some collaboration between the academicians and researchers through working groups to create dissemination platforms on the pandemic. La Universidad Nacional Autónoma de México has organized working groups to do this scientific research with the specialists from several states in Mexico, Michoacán and Yucatan, and as well as the campus in Mexico City. We have a research center and advanced studies del Politécnico Nacional, the National Polytechnic Institute, that is working in groups and has been doing some research and disseminating information mainly on COVID-19. And we have developed a digital platform for science dissemination that is called ProCiencia, where scientific data about the pandemic is available. And I would like to share with you what have we been doing at the Mexican consulate here in Los Angeles. Since the beginning, you know, as Consul General, my top priority was and still is to keep safe and sound my team, my work team, and of course the community as a whole. As you know, we provide citizen services, and we used to be visited by more than 800 people every day. So we have to, in order to comply with the measures that the city, the county, the state, and the whole nation here in the United States put in place, we have to reduce all these services, and we just are available for emergencies. And nowadays, little by little, we are increasing such services to all requests. We have an open communication and permanent dialogue with the community, the private sector, and different organizations, and of course the authorities. But the most important thing is that besides the citizen services, we're also providing human services. That's not in our job description. That's not in the Vienna Convention of Consular Affairs. But we're doing it, and we're doing it successfully because we have a great alliance with Feeding America, with Power of One. We are assisting and providing these pantries to not just the county of Los Angeles, but also to other places through our consuls in Fresno, San Bernardino, Oxnard, and Santa Ana. From the consulate, we created campaigns to inform the community about food banks, hospitals, shelters, COVID-19 test centers. Also, we elaborated a resilience manual that has been proven to be very good, because there we provide information regarding the different resources available to the community. This goes from health services to how to avoid fraud or to denounce domestic violence. So the different aspects, and we have all these resources from the city, the county, and the state, also at federal level. Sorry. We also have a call center that is that we put in place and is very helpful. And another concern for me is how, you know, I was going to be able to be close to the community. So we started an Instagram live series with there I had the opportunity to have conversations and to listen and to see different people, listen their different voices. So to get to know what they're doing through the pandemic, how they're facing it, and the most important, how we can help each other from different perspectives. Writers, community leaders, entrepreneurs, psychologists, sports people, LGBTQ community. So this has been a wonderful experience, and I am very happy that we started this project in March. At the end of March, we didn't know that we have in June. We are still with this. It's complicated, and so also we have like our signature initiative that is called De Víctimas a Protagonistas, la Comunidad Mexicana en Los Ángeles, from victims to leaders in the Mexican community in Los Angeles. And the main objective is to empower the Mexican community and recognize the important contribution to this society. I want to put a special attention in one sector of the migrant community, and these are the farm workers, the agricultural workers. According to the US government, there are more than 20,000 Mexican agricultural workers in California covered by the H-2A visa. But you have to keep in mind that according to data released, I think it was UC Davis, there are approximately 850,000 undocumented farm workers just in California. And the majority are from Mexican origin. And they have been proving and before and through the pandemic that they are essentials. So just to know that 2/3 of the US fruits and nuts are grown, as well as 1/3 of all vegetables, thanks to these people. And thanks to the California agricultural work, also supermarkets throughout the country are kept supplied, which shows that how essential the Mexican workers are, not only to produce food, but also to guarantee that they can be purchased at low prices throughout the United States. And of course, they are contributing to maintain this food supply in a global scale. So we are very committed to help our people, and we work very closely with their employers to assure that they have the health conditions and they have all these personal protective gear, so they are not contagious. And if they are, they have the health services, and the others, the ones that are healthy, can keep on working. So to finish this participation, I would like to share with you that I think that all of us share this, that there are a lot of reflections going on. And one of my main reflections during this pandemic is about the impact. And I don't know if we will be better or worse human beings after this pandemic, but something that I have very clear is the responsibilities. I think that the ones that have the opportunity and the position to help others are even more responsible to contribute to build a better world. I always do this metaphor that we're in an ocean, and maybe, you know, there's el crucero in a cruise, or in a yacht, or I don't know, una lancha, you know, a boat, a single boat, or a speedboat, and some of them just have like a piece of wood. So I think that the ones that are in a better position should help the others. And, you know, of course, there will be the ones that they don't want to help and even do us harm. But I think that the wood ones will prevail. And another reflection is that this pandemic put us on is that we should take a look at our international organizations and have some, you know, analysis of what we're doing right, what we're doing wrong, what would be better, And that is the same in North America. Now that we have the USMCA, I think that is very important that the three countries are respecting the institutions, are respecting the law. And for me, it is very important because that gives us certainty. Also, Mexico is looking forward to keep on, the US keep on issuing the H2 visas and even increase the number of H2 visas, H2A visas, because we are committed to lawfulness. I am committed to lawfulness, to encourage lawfulness. And I think that also we have to recognize all the work that these migrants are doing, and in within a legal framework. So definitely we have to take into consideration in the agenda of Canada, US, and Mexico, the pandemic and the challenges and what we were after this, what we want. So that will be my, and was 25 seconds to finish.
Thank you very, very much for that. I really, really appreciate it. Appreciate the reflections. I would now like to ask Consul General Zabe Sheikh to give us the Canadian perspective on the same thing.
Thank you, Glenn. And as the ambassador said, thanks to UCLA, thanks to Professor Needleman, and thank you, Embajadora. It's always great to join you in these kinds of discussions. Your eloquence is noted, and it's always a challenge to follow you. But we will continue on. Thank you, Glenn, for acknowledging, first of all, the indigenous communities who have been caretakers of this land for a long time, and those future generations to come. And thank you also for acknowledging what the US and Canada have been going through in a very tangible way in the last few weeks after the unfortunate, tragic and violent death of George Floyd. And so our thoughts go out to his family and his friends. And as the Prime Minister said, anti-Black racism exists clearly, is a systemic issue, as is indigenous prejudice. And it's been too long, and we must eradicate it. We must work for it. And the beginnings of that start with acknowledging it, frankly. And so thank you for acknowledging it. And Canada stands to acknowledge it as well. And the work then begins from there, because acknowledgement clearly is also not enough. And the backdrop of all this is also the global pandemic that we're all talking about today. And that makes things incredibly difficult, and yet somehow also much more meaningful, because the idea of community, as the Embajadora was talking about, that idea of what it means to help each other, to be connected to each other, that has been put in great perspective, I think, as 2020 has hit us. And so to give you a little bit of sort of facts around what's happening with COVID-19 in Canada, there are now 96,244 confirmed cases, but that includes more than 54,000 persons that have recovered. So that's almost 57% of the cases have recovered. And unfortunately, about 7,800 deaths, 7,835 to be specific, because I don't want to leave anyone out. So far, over 1.93 million individuals have been tested. And that means approximately 33,000 every day getting tested, and 5% testing positive. The Prime Minister, as those folks who follow what the Prime Minister says, especially for your Canadian studies folks, has said that public health and reopening rules will vary across Canada. And I know we're going to get into that idea of federal and provincial, depending on the local context, but that the basic rules, such as social distancing, will remain. And he added that testing and contact tracing will be essential for a successful reopening. A little bit about the dates and things that have been happening around Canada in terms of triggers. Well, on May 18th, the Prime Minister announced that Canada and the US have agreed to extend the borders measures implemented until June 21st. So as the ambassador was saying, we are all looking forward to that date and seeing what happens. And, lots more data to come over the next couple of weeks to ensure a meaningful decision based around those things. So what that means really is that Canada and the United States have agreed to temporarily restrict all non-essential travel, including for tourism and recreation across the border. But it does still tightly preserve the supply chains, as was discussed earlier, including trucking. So those are considered essential and they're not impacted by the restriction. And the same stipulation has been made for Canadians and Americans, whether they travel across the land or across the air. The COVID Emergency Act, COVID-19 Emergency Response Act that Canada enacted was first enacted on March 25th, 2020. It guaranteed the rapid implementation and administration of measures to protect Canadians' health and safety and to stabilize the Canadian economy. It was then number 2 was passed on April 11th. This legislation made sure that the government can do what it takes to support Canadians and Canadian businesses and the economy in a timely manner. And that's another key thing, which I'm sure we're going to be discussed, that idea of timeliness, those decisions that we all have to make. So taken together, currently, the Government of Canada's COVID-19 economic response plan will be providing up to $107 billion in direct support to Canadian workers and businesses, $85 billion in liquidity relief through deferred payments, and over $570 billion in credit and liquidity supports delivered through Canada's Crown corporations, the Bank of Canada, and of course, other financial regulators. So the plan builds on what is a coordinated action taken to protect the health and safety of Canadians, including more than $1 billion specifically in COVID-19 response fund, which provides funding to the provinces and territories to strengthen their critical healthcare systems, as well as over $2 billion to ensure the availability of personal protective equipment and supplies. So that's a bit of a snapshot in terms of what the immediate actions were taken by the federal government. Of course, that is policy, and how it now breaks down is very important. The government continues to work with provinces, territories, and municipalities, in fact, and to follow the advice of health professionals. Canada is a country committed to making its decisions based on data, fact, and science. The Canadian system, the provinces have jurisdiction actually over direct healthcare and education. It isn't the federal government. But the federal government, of course, has an overall public health role and an overall guidance role. So we are taking that seriously, and our public health official, our chief public health officer, Dr. Tam, has been instrumental in leading, frankly, the global attention on this virus, but also specifically speaking to Canadians, giving them a sense of place and a sense of meaning in what can sometimes seem like a meaningless and very random, frankly, predicament. It's important to note that all provinces have imposed moratoria on evictions. They've ensured childcare capacity for essential workers, and they've paused on student loan payments. That's something that all the provinces are kicking in to do, and that's key, I think, to the recovery. Smaller provincial governments, of course, have less fiscal capacity than the larger provinces, so they have largely left the economic response to the federal government, and those were those billion-dollar envelopes that I was talking about earlier. Of course, the Government of Canada doesn't just talk to its provinces, it's also trying to ensure the needs of a pan-national population. So the First Nations communities, members of the Canadian Armed Forces, they are also being met with, and measures are being put in place to mitigate as much as possible the impacts of COVID-19. I'll be honest, in the economic response, of course, the federal government has been doing its duty in doing most of the heavy lifting, given that it has its stronger fiscal capacity and that its expenditures are backed by the Bank of Canada. And on that note, on June 4th, the Prime Minister and Deputy Prime Minister, both Trudeau and Deputy Prime Minister Freeland, held their 12th weekly call They have weekly calls with Canada's provincial and territorial premiers to discuss what those shared responses are to the COVID-19 pandemic. And it's important to note that, in fact, all the premiers of those provinces have reiterated their support for the Team Canada approach. Which, may, for those who are politically aware of what's happening in Canada, that's a lot of different types of leaderships and parties and frankly, political beliefs and values who are coming together at this time and working with the federal government consistently and in coordination in, as I said, a kind of a Team Canada approach to fighting the virus and reopening safely. So if you break it down, the majority of the COVID cases have been in Canada and Quebec, the two largest provinces. And so those provinces, of course, are keeping their, whether it's quarantine or isolation measures, they're keeping those intact for now. Although recently, Ontario did decide to increase social gatherings to 10. Allowing certain regions to reopen, including patios and hair salons. I'm sure people will be happy to hear that. I know I will at some point when LA is happening too. Toronto, of course, is like we hear in large cities, LA, New York. Toronto is among those excluded areas where they are still taking their own specific measurements and specific science around when and what opening and reopening will look like. So, as I mentioned, the Government of Canada has announced a whole host of economic measures to help stabilize the economy. And what the intention of it all is that this kind of wide-ranging support is going to help ensure that Canadians can not only pay for rent, but also pay for groceries. And it's meant to help businesses continue to pay their employees and their bills during this time of uncertainty. So it's important to know that also funding has also been given to organizations that serve the off-reserve Indigenous population, not just working with the reservations, but a specific focus on the Indigenous population who is off reservations. And of course, as late May, the Prime Minister reiterated that ending the pandemic in Canada will depend on it ending globally. I mean, that is a key factor. And that the same applies to the economic crisis created by the virus. This idea that, as the ambassador was saying, it's going to take a community, but not just a community within our own North American sphere, although we will be key in moving forward, but that reset and recovery really depend on a global, communicative, and coordinated response. And that may be a challenge. It clearly is. But Canada is seeing, frankly, Canada was going to be expecting probably a challenge between the federal government and the provincial response. And what we've seen is that challenge has been met fairly easily because ultimately it's about Canadians. It's not about the various, at this moment at least, it's not about the various leaderships or the various parties. It's really about what is happening to Canada and Canadians. And I think that in terms of how that plays out to a consulate service and team here, and we represent Southern California, Nevada, and Arizona, like the ambassador said, our key and my key as head of mission, as it's called, responsibility is to our team. First and foremost, the safety and health and well-being. And that's not just physical, that's emotional and mental as well. And so you think, just when you think you're out of the water and you got your team physically healthy and they're all consistent, and why are they meant to be healthy? Well, they're meant to be healthy so that they can help Canadians in territory. It's that old adage that you hear when we used to be able to take, planes and trains and automobiles to various places without, is that if that oxygen mask falls, you put it on yourself first before you put it on someone else, because you need to be able to be there for the other person. So our responsibility has been to our team members so that they can then in turn help Canadians in territory. And as we've seen, because we're on the West Coast, it's actually helping Canadians who are coming from outside of the territory because they've been coming on cruise ships. So they've been landing in LA or San Diego and then having to move beyond onto Canada. And so we have helped repatriate, frankly, Canadians from across the world who were hubbing in here. I know that the news is, everybody knows what's been happening with the cruise ships and all the flights coming in. And so to be able to do that was a monumental effort, something that Canada has done globally in unprecedented numbers. And it's important to note that it's also, as many countries have, Canada's also taking an unprecedented economic approach to this. And then beyond that, in terms of the reflection of how it affects us, is that we've been trying to reach out, as has the Embajadora, on various platforms. We've really had to become nimble, frankly. Federal governments and government institutions aren't used to being nimble and quick. They're used to being policy oriented, but then things take time, and the legacy, frankly, systems and platforms and technologies are usually not up to speed. And so we've had to shift gears, and whether it's being on this kind of Zoom call or, as the Embajadora said, on IG Live and connecting with folks there. That's been something that we've been doing as well, because lots of communities and different businesses have different platforms, whether you're on LinkedIn, whether you're on IG Live, whether you're coordinated on Twitter. Sometimes it's Microsoft platform. And of course, Zoom has been, I'm sure their stocks continue to rise as we speak of them and on them. But that idea of having to become nimble and coordinated has been something that we're very proud of here in LA that we've been able to take on, but that wouldn't have been possible if we didn't have the support of the Canadian government and the federal government. And so that's in a nutshell what we've been doing and how we've been reacting.
Well, thank you very, very much for that. And both of your presentations have given us much to think about and much to maybe compare and contrast and with the United States. And so I'd like to ask then Professor Needleman to then give us his perspective.
Okay, great. Thank you, Glenn. Thank you for the introduction. Thank you for the invitation to join these extraordinary colleagues from Mexico and Canada to reflect on how federal structure can and has affected the COVID response here and elsewhere. Some interesting contrasts. I appreciate the opportunity. I'm going to step back before I talk about the U.S. response to provide a little bit of structure for thinking about what we've heard and how to think about the U.S. structure, and really from two perspectives. First, to think about what a public health response to a new pandemic should look like, could look like. So we have a baseline for assessing how well we've done. And then the second is to talk about, in a federal structure, what the resources and strengths are and the nature of interactions between the federal and the provincial, provincial, municipal levels are. And where there are opportunities for coordination, what happens if that coordination fails? And then I will turn to the U.S. So with respect to, what should happen when you've got a new pandemic, and we heard Anthony Fauci talking about this being his worst fear a few days ago, until you have an effective vaccine, and once you've got a highly transmissible infection going on in your community, the first thing you want to do is tamp it down. There's exponential growth, and we see that in all these curves that have been presented of how steep the rise in cases has been. So you want to tamp it down, and that means closing things down, sheltering in place, minimizing contact to that which is essential, to protecting those who need to go out to work, not only to protect them because that's the ethical and moral thing to do, but also, again, to reduce transmission. And as we've been reminded by the thing, there are economic repercussions of shutting things down, and you want to take steps to minimize those as well, both for individuals and for governments and for businesses. So once you've got the rate shut down, once you've got the pandemic cut down to where it's close to zero, then you want to start opening up with constraints to keep the new cases low. Physical distancing, reconfigured work, social spaces, masks, a lot of testing. And the object here is to keep the rate so low that you can basically do spot work to constrain via testing and quarantine. That's the vision of how to deal with it. We also knew there's a lot of things we don't know with this new pandemic, how transmissible and so forth. So there's a need to deal with uncertainty, to learn by doing and learn as one is doing. And that requires expertise to not only fashion the best response initially, but to actively be trying to learn from it. And the third thing is the importance of communication. Not only to tell people, here's what you need to do right now, but to create a long-term vision of here's where we're trying to go. Here's what's intended. Here's what the problem is. Here's how we're going to deal with it in the short run. Here's how we're going to deal with it in the long run. Here's your role in this. So that communication becomes a critically important part of dealing with a pandemic response. And I'll come back to that in a few moments. The other thing we're dealing with in all three of these countries is federal systems, and the resources, the constraints, the roles differ at each level, and that's important to capture as well. So at the federal level, there are a lot of resources across all three of these countries. There's size, there's personnel, there's expertise, and financial resources, all of which can be brought to bear and have been brought to bear in this. In most of these countries, the data resources are at the federal level for consolidating and doing, but often they're slow because they require things coming up through the local levels. The federal level can create networks down, but they can also use those networking opportunities to create networks across. So you've got a web of networks going on with the leadership at the top helping to structure the communication and helping to make sure the communication is there. And finally, the federal resource is visibility. The leaders at the federal level can claim space on national media in a way that state leaders or municipal leaders often cannot. So those are some of the resources. There are constraints. We've got constitutional constraints. We've got constraints of role, which as the Council General noted about Canada, operations are usually at the state and local level, while policy and funding are often at the federal level. So we've got those different roles. You've got physical distance and that perception of distance between the federal government and the local environment. And as I know, limited operational capacity. So that's what we're looking at the federal level. At the state and municipal level, we've got operational organization and operational expertise. The state level, the local level, that's where boots are on the ground in terms of getting services to people, getting things done, getting unemployment checks written. You've got that local presence, and you sometimes have data. Those are some of the resources that you see at the state and municipal level. The constraints, perhaps in the US, the biggest constraint is constitutional budgeting constraints. The feds can run deficits, state governments and local governments cannot. So they look at the issue of getting funds and getting funding for action very differently than the federal government does. The other thing we note, and this was also noted by the Council General of Canada, it's tremendous heterogeneity. We've got states in the United States like California, nearly 40 million. I think that about matches the population of all of Canada. We've got other states, Texas, 20 million, New York, 15, 16 million, Florida, 16, 17 million. Those are big places. Those are country level capacity with expertise and professionalism to match. But we also have states at the other extreme, Wyoming with 600,000 people. There, the expertise, the sheer numbers of people needed, the resources are simply not going to be there. And those places, those states are much more dependent upon the federal government for expertise and advice. They want to pick up the phone and call the Centers for Disease Control, CDC, and say, what should I be doing now? Because they don't have somebody who's been trained at CDC, who's now their health commissioner, who knows what the answer to that question is going to be, indeed who may have written it while they were fed, or written it as part of their state plan. So you've got that tremendous heterogeneity in expertise, in resources, and so forth. And finally, across the different states, you've got political and ideological heterogeneity, and that will also affect the responses. So those are the resources we have. That's the kind of expertise and the differences in roles that I see. And I begin looking and say, so how do we do? How did this influence the response to COVID in the US? And as a consultant before I became an academic, I had clients as the Centers for Disease Control and clients who were state health departments. I know how good those people can be. And I know how much expertise there is there, not just in those organizations, but in other federal agencies and other state agencies, and frankly, even in the staff of many of the legislative committees in the Congress and the state legislatures. So we had tremendous expertise at the federal level, incredible strengths and expertise in organization, in resources, in prior planning, that frankly have been squandered in the federal response in the US, leading to a very slow and muted response. I think we've seen a slow and reluctant start to acknowledging that we're about to face a pandemic and responding to it in the executive agency, at the highest levels of the executive for sure, to some extent in the legislature. We saw a relatively strong start to reduce economic displacement, $2 trillion enacted in the month of March, but a much weaker public health response. We saw the substitution of political leadership for leadership from those who have substantive expertise. Rather than leaning on the experts, we saw the experts being forced to accommodate to prior beliefs of the executives. We saw a core mobilization of expertise within the agencies. You see that in the US in the way the CDC guidance on what to do and how to deal with social distancing and how to open up all sort of got watered down, came out late, came out with muted and very muted presentation of this is here's where we need to be. The national visibility and the platform that is provided by being the federal government were simply not used to communicate a strong public health message. And there was real political and idiosyncratic allocation of resources at the federal level that I think have weakened the response. So to some extent, states and localities depend upon a strong federal leadership to coordinate what they're doing and help them do it. So what have we seen in response to, at the state level, in the absence of that federal leadership and coordination? Well, the response has been uneven across the states due to variations in expertise, political and ideological preferences. Some state leaders have clearly emerged, Ohio, California, others. We've also seen the states replace the federal, what would have been a federal networking initiative with their own networking. We've seen the creation of regional and non-regional state compacts to establish direct state-to-state coordination and sharing, recognizing we're not getting the leadership that we've expected from the feds, and we're going to have to replace that. And there's a long history of state compacts and interstate compacts in the US going back to the middle of the 19th century, but nobody expected to have to do it on the fly to deal with an immediate problem like this. And we're now seeing a second wave starting that will be higher than it needs to be because of the weak and less strong, less clear, less public healthy initiatives that we've seen. As a public health person, I'm extraordinarily frustrated.
Okay, thank you very much. There's a lot to think about there and a lot for discussion. And so I'd just like to ask Ruben if he has a question, if he wants to get things going, and then Brian can tell us what we've got coming in from the audience.
Well, so far we don't have any questions submitted using Q&A, so I would strongly encourage our attendees to think about questions that you could address, that you could pose that address the issues raised by our three panelists, and go ahead and submit those. But for the time being, Ruben, if you have any questions, or Glenn, if you do, that'd be great. And if not, I can, I've got a few questions myself.
I actually have a question that I like to pose to actually our three panelists. I've actually have been studying migrant agricultural workers for the past few years. And this is in fact something interesting because mobile or migrant agricultural workers is something that the three countries share. And they also, the three countries actually share the fact that, you know, these a very sizable component of that population is actually Mexican or of Mexican origin. There's a very large population of domestic migrant workers in Mexico. As Ambassador Celorio mentioned, there is a large number of documented and undocumented Mexican migrant workers, and there's about 30,000 Mexicans who migrate legally to Canada to conduct agricultural work every year. One of the things that I have been concerned about, together with some colleagues in Mexico, and we wrote actually a brief on this a couple of months ago, is what can the three countries actually do in order to address the risk, of course, that these migrant workers face in the workplaces, in dormitories, but also the kinds of risks that these workers face and their communities face when these migrant workers go back to Mexico and go back to their communities of origin. What kind of federal state coordination, what kind of tri-national coordination or binational coordination exists or has been proposed in order to address these existing as well as potential and likely risks. I don't know who wants to take this on first.
I would just quickly, and I'll probably being the northernmost country of that, as you said, and having the not as many of the constituents being up in Canada, though, as you said, a sizable figure. I really think that it's something that the ambassador and I have been talking about this week as well, this idea of what happens once the USMCA really takes hold as of July 1st in a few weeks. And I think that idea that you just posed, Ruben, of tri-national, I think that's going to be key in this next phase of discussions, not only in terms of ease of moving back and forth and the essentialness of those businesses and those workers, but also the health and safety. I think there are provisions in chapters. Those would have to be really looked at, and this would have to be on the table. But the mechanisms, frankly, already exist, but definitely as of July 1st, exist in a lot more tangible manner.
So let me offer a couple of additional thoughts to that, Ruben. One is, one of the things this pandemic has done is helped us get a better understanding of who are essential workers. And they're not the folks that were typically identified as the essential workers. And the other thing is how many of the essential workers in this country are from marginalized populations. Migrants doing the work, undocumented migrants who are here, folks who are minimum wage jobs over and over again. One of the challenges of dealing with the pandemic is protecting those who need to work, and protecting those who need to work for them because of their own family circumstances, but also who need to work to provide essential services to us. And we've seen some cases where that has happened relatively quickly, at least in some ways. The plexiglass shields that have gone up in supermarkets, that have gone up in other retail places, to the change in circulation distributions in stores. Agriculture is a special problem because of the people are working outside. They work in ways that they coordinate with one another. So the question is how to keep those workers safe, what kinds of protective personal protective equipment is appropriate, making sure they get it. And the other issue is as they move, how do we make sure that those who have acquired the illness, who may be able to transmit it, are kept isolated enough without harming them to keep the transmission rates down as people move from place to place. I think that's one of the ongoing challenges here, and thinking about that transition from place to place and how to manage that effectively.
Ambassador Celorio, I think you were muted before, so
Yes.
please go ahead.
Yes, well, I would like to share with you that we have identified three important aspects on how to address this issue. First of all, here in the United States, we have to keep on with the lobbying in Washington, D.C., so these workers will be able to have the recognition of their rights. It is very important. I don't know if you're aware, but the employer is not compliant to provide gloves, for example. So these kind of things are very important. The second one, we already talked about it, that is regarding the personal protective equipment, the physical distancing that is very challenging, and health services. But the third one has to do with the recognition of what they're doing and how they contribute to the society in the States, the three countries, and in a global perspective. And we should show gratitude. I think this is very important. When these people come to the United States, when they migrate, they are doing it because they are finding a job for economic reasons mainly. And the fantastic thing about the H-2A program is that they can come, they can work, and they can go back to their countries, to their families. We're Latins, and we want to be with our people. That's the truth. So when this restriction to come into the United States, building the wall in the 1990s with the gatekeeper operation, if you remember, the circularity that we used to have, it was broken. So we have to recover that, to give them the opportunity to work here, to contribute, and to go back to their country as the program that we have with the Canadians. So I think that's very important. And what we're doing in Mexico is, if we know that someone wants to go back, we have a very good communication at the federal, but also with the different states in Mexico to see how we can identify health services, education, housing, job, so they just not go back to a country that they won't recognize and that they feel that they are embraced again.
Thank you very much, Brian. I see that we do have a number of questions there. Do you want to pose one of the viewers' questions?
Sure. So we have a question from Evan, and I'm going to paraphrase a little bit. I hope that Evan doesn't mind. And this question is going to be directed specifically at the two consul generals. And so Evan's question is, has the relationship, so of course Canada and Mexico have bilateral relations as well, right? And but of course they each have this much larger, mutual neighbor that stands in between them. And Evan's wondering if the United States being in between in many different ways has complicated the relationship and movements of people between Mexico and Canada. And I assume he means particularly during the pandemic. So for example, the movement of foreign farm workers, shipment of goods, especially agricultural goods. How has the pandemic, the location of the US in between Mexico and Canada, and the border being closed between the US and Canada and the US and Mexico affected Canadian and Mexican bilateral relations during the pandemic?
From the north, at least, of that relationship, I'd say that, in fact, as we look to when the negotiations for USMCA were happening, and we'll get to the pandemic part of it, but this idea of the closeness of the two nations and having a superpower, if you will, in between, actually, the USMCA negotiations actually helped foster greater connectivity in many ways between Mexico and Canada, because the idea that Canada was able to offer some tactical functional assistance and support as Mexico looked to shore up some of the chapters and clauses within the agreement. I'm thinking about the gender equity chapter. I'm thinking about the environmental chapter. I'm thinking of the labor standards. We weren't there. Canada and Mexico did not have a relationship which was an adversarial relationship there. It was really a support relationship. It was one of tactical support, tactical advice, and sharing, frankly. And while at the outset of those negotiations, it seemed very complicated, how were any of these nations going to react to each other and relate to each other through those negotiations? And I wasn't a great part of it. I've only been a recent consul general, but I've been able to see the literal fruits of those labors, which are the kind of connectivity that I even feel with Ambassador Celorio. That idea of what it means to be a Canadian-Mexican partner is key. In terms of the pandemic, the supply chain, we have to remember that the borders are closed to recreational and tourist travel. And so essential businesses and a movement of the supply chain is actually a priority between the three countries, and especially as we look to USMCA. The idea is that, at least from Canada and Mexico's perspective, because this is, and I'll say from Canada's perspective, because the question is about those two countries, is that it is a united identity that we need to take into the future, whether it's about the global supply chain, frankly, because North America is going to help engine the world from that perspective, or whether it's this idea of security and place of community and the identity from the land, the air, the sea. That is much stronger, I would say, now than perhaps it ever was, because of these new phases that we are in of the agreement, but also because of what the pandemic has revealed.
Yes, I would like to subscribe 100% what my colleague and dear friend Said Sheikh just said. I just want to add that it's very important that we focus on our shared values. Remember that we are democracies, that we are pro-free trade, that we are pro-human rights, and we're avant-garde countries in the sense that we are, and now, as you mentioned earlier, we're confronted with the discrimination and racism, but that's not who we are. So we have a lot in the agenda that we share, and we are committed to advance. So for me, it's very important as a regional bloc, we have to strengthen that commitment with the underlying values that we share, and I think that we will prevail.
I think, unfortunately, we've come to the end of our time, but I cannot think of really better words to end, and uplifting a message of the fact that we are in this together, we are a bloc. And so I think that is really, really wonderful, wonderful thoughts to take with us. And I'd just like, Ruben, do you have any last thing to say, or Brian? Ruben, you're muted.
Sorry. Yeah, I just want to thank our distinguished speakers. Thank you for their insights and their time. Ambassador Celorio, Consul General Sheikh, and Professor Needleman for sharing these insights, and we certainly look forward to future opportunities to continue this conversation and this very valuable exchange. Thank you very much.
I thank you all. I thank the audience, and the conversation will continue. Everybody stay healthy and safe.
Thank you, everyone.
Goodbye.
Thank you. See you soon. Bye-bye.
Bye-bye.
Take care.
Bye-bye. Thank you.
Thank you everyone for attending, and please check out the websites of the Latin American Institute, the Center for Mexican Studies, and the Canadian Studies Program to find out about future events related to our three countries and future collaborations between our centers. Thanks.